Okay, welcome everybody. Thank you for joining us. This is the Behavioral Health System Redesign Steering Committee meeting. So last week was our full CRIS committee meeting. This week is the steering committee meeting, which is a subset of CRIS committee members. And I'll repeat that a few times because I know it can be confusing with all of these meetings that we have, which meetings we're focused on. So before we get started, I just want to do my spiel about the Zoom and how we do these meetings. So Nicola, would you mind just putting the slides up on the screen and I'll walk folks through the tech? Thank you. All right, so as always, I have two slides. The first one is for our steering committee members, and the second one is for our guests and community members who've joined us today. So for steering committee members, if you could keep your mics on mute unless you're speaking, but your video camera's on if it's available to you. That helps us facilitate and collaborate with each other. Moving along, if you would like to speak, please use the raise your hand function. You click on that reactions button, pops up a window, and then you'll see the raise your hand function. And you can either lower it yourself or I'll lower it. I'll call on you in the order that you put your hand up. And of course, steering committee members, as I say, if all else fails, you can wave your hands at me. This is just for steering committee members. It's only going to be steering committee members to be speaking today, with the exception of the person who's sharing their personal story today and some of our team members who are presenting today. And Nicola, if you could just advance us a little bit. The steering committee members, if you have any technical issues today with your Zoom, you can use the chat button to chat with Elizabeth Tenney. She's staffing our tech today and can probably help you resolve most issues. And then if you would like to offer a comment or ask a question in written form rather than in verbal form, you can use that chat to reach me. You can advance that button, Nicola. And by the way, I should have said this at the beginning. I always forget. I'm Jamie Strauss-Clark, she, her pronouns. I am your facilitator today. Okay, Nicola. And then if you would like to be able to see each other on the screen, I recommend clicking that speaker view button in the top right corner and then clicking on gallery view. All right, so this is for our members of the public and community members. Again, this is a steering committee meeting, so the participants today, the people who are speaking and raising their hands to comment, are going to be steering committee members. So for members of the community, if you could also please leave your mics on mute for the duration of the meeting. If you could keep your video cameras off. Again, that just makes it easier for me to be able to focus on facilitating with our steering committee members. Obvious exceptions are if you're participating in the public comment at the end of the meeting today, in which case I will invite you to turn your video camera on. If you could advance, Nicola, please. Same deal with the speaker view. If you'd like to see as many of our steering committee members as possible, you can click on that speaker view button and click gallery and you can see everyone. I also want to note that we do have our ASL support today. You will see it, their screen spotlighted on your video. So they'll be here they'll be on the screen for the duration of the meeting. Today it's Amanda Wilkes and Andrea Medlock, and they're actually going to be on the same camera today. They're in the same location. So they will be switching off every 15 minutes throughout the meeting. All right, I think we can move on to our welcome introductions and review our meeting agenda. So actually, Nicola, if you don't mind just stopping the share for a moment. So originally the plan was that Representative Orwell would be offering the welcome today. She's been called away at a last minute conflict, so is unable to join today. So I will offer a welcome to all of you that won't be nearly as articulate as hers, but I just want to say a hearty welcome to our steering committee members and our community members and guests who are joining today. I know that this is having a 2-hour meeting on an afternoon is not insignificant for many of you, and I really want to extend on behalf of the steering committee appreciation for all of you taking the time to participate in this process, to listen and be at these meetings, to provide your public comment at these meetings. It is really meaningful, and I know many of you are also participating on subcommittees, and that's making all the difference. So big welcome to our community members and guests today. And of course, a big welcome and thank you to our steering committee members. Today is actually a culmination of a lot of work that's been done to create a vision for the behavioral health system redesign. And so we're going to be, as a group, discussing that and coming to a place where we can affirm and put it into action. Before we move on with our introductions and walking you through the agenda, I'd like to ask Mark Snowden to offer our land acknowledgement today.
Thank you. I'm Mark Snowden. I use he and him pronouns, and I'm with the University of Washington and Harborview Medical Center. I'm calling from Harborview, which is part of the University of Washington, and I acknowledge the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. I add that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, who continue to pursue their federal recognition. The tribes invest heavily in exemplary natural resource stewardship programs. I want to thank the tribes for this stewardship. I encourage everyone who lives in the Seattle area to learn more about these efforts, to be equally conscientious stewards of the land and supporters of the tribes.
Thank you, Mark. Now I'm going to ask each of our other steering committee members to briefly introduce yourselves, your name, your pronouns, and the agency or organization that you're representing or area that you're representing. And also if you could indicate if you're a voting member on the committee as well. So Mark did his introduction. He is a non-voting member of the steering committee. I'm going to call on you in the order I see you on my screen. So next is Bipasha. Bipasha, you are on mute.
But of course, my name is Bipasha Mukherjee. I'm on the steering committee and CRIS committee. I'm also a non-voting member. I represent people with lived experience on this committee.
Thank you, Bipasha.
And she, her pronouns. Sorry.
She, her pronouns. Thank you for that. Next is Michelle Roberts.
Good afternoon, everybody. Good to see you. Michelle Roberts, she, her pronouns. I'm the Assistant Secretary for our Prevention and Community Health Division at Washington State Department of Health, representing the Department of Health on this committee and on CRIS, and I am a voting member.
Thank you, Michelle. And then next is Senator Dhingra.
Good afternoon, Manka Dhingra. I use she, her pronouns. I'm the state senator representing the 45th legislative district, and I'm the deputy majority leader of the Washington State Senate and a voting member of the steering committee. Thank you.
Thank you, Senator Dhingra. Amber Leaders.
Hi, Amber Leaders, she, her pronouns. I am Senior Policy Advisor to Governor Inslee on behavioral health, aging, and disability, and I am a voting member.
And I want to alert everyone, as I mentioned earlier, Representative Orwell was called away and is not able to join us. She is also a voting member. And then Carrie Waterland also has a conflict today and is not able to join us. So we are doing a little bit of shifting in our agenda for a couple of reasons, including that we have 2 voting members who aren't able to be here today. I will walk you through that momentarily. So let's give Nicola a moment to put the slides back up on the screen. And while she's doing that, I just want to have some staff introduce themselves. So Betsy, if you could just briefly introduce yourself as well, that would be great.
Good afternoon, everyone. Betsy Jones, she, her pronouns. I am the lead for Health Management Associates, facilitating the work of the 1477 crisis system redesign and 988 implementation. Nice to be here.
Thanks, Betsy. All right, so I'm going to walk you through our objectives for today. As ever, we are continuing to build and sustain collaborative working relationships with each other. Today, our original plan was to discuss and affirm the vision and guiding principles for the crisis response system. Because we have 2 voting members who are not present today, what we're going to do is we're going to proceed with that discussion of the vision, but then conduct a separate voting process via email afterward and post those results to the website. In addition, we're going to work out, we realize we need probably a clearer and more formalized policy for how we handle situations when we have a vote planned on the steering committee and a steering committee of voting members not able to be present. So we will be adding that to our charter and confirming that at our next steering committee meeting. Next, we're going to be also providing an update on the development of the Section 109 technical and operational plan. And you'll be hearing a few more updates relevant to the steering committee. We will very briefly confirm action items and next steps at the end of the meeting and then leave time for public comment. And we have 10 people signed up for public comment today. As ever, those of you who signed up for public comment, if you need an accommodation today, for example, if you need a slightly longer time to share your comments for whatever reason, please do send me a chat. It'll help me plan for the last part of the meeting. Right now, I'm intending to leave 2 minutes for each comment. And I will be using a timer to manage that time so that we can make sure we get everyone who's signed up an opportunity to comment. Again, if you need an accommodation and need a little bit more time, please send me a chat, and that way I can adjust those times as necessary. All right, Nicola, if you could advance the slide, I'll just help everyone understand how we've shifted the timing a little bit. This looks a little bit different from the agenda that we sent out last week, and I'll explain why in just a moment. After we do the welcome and introductions and review the meeting agenda, we'll move to our personal story. And today, Laura Van Tosh is offering that personal story. Then we will move into our discussion of the vision and guiding principles for crisis response system. As I mentioned, we're going to make a little shift and do the voting at another time. And just so you know, the 2 voting members who are absent today have been briefed on the latest version of this vision and guiding principles. So they are up to speed. So we should be able to complete that voting exercise via email following the meeting. We did some adjusting of our schedule today to accommodate a little bit more time for the Section 109 Tech and Op Plan update. We understand now that there's more information that can be shared today, so we want to leave a little more time for that, which is why we've done some shifting in the schedule. There will be some brief updates toward the end of the meeting on other issues relevant to the steering committee, and then action. Can I just remind everyone to make sure you mute your mics if you aren't already? That I'm hearing a little bit of background noise. We'll be doing action items and next steps, and then move into our public comment period and adjourn at 5:30. I am, in the interest of time, going to skip everybody's favorite moment, our ice melter today. So I apologize for that, but I do want to leave enough time for all of the important information that's going to be shared today. So now with that, I am going to turn it over to Bipasha Mukherjee, who is coordinating our personal stories. Bipasha, you are on mute again.
I'm never going to get this right. That's okay. Thank you, everyone, for reminding me. Okay, Laura Van Tosh will be sharing a part of her story with us today. I say a part because after chatting with her, I realized how committed she has stayed for decades on her own mental health journey. It would be impossible for her to capture all of it in 5 to 10 minutes. Along with the personal journey, Laura has an extensive involvement in the mental health system as a professional and an advocate. Her involvement spans work in institutions across several states, direct client support with people who lived on streets, and she has directed peer-run services. That's not all. She works on legislative and policy issues that impact behavioral health access and care at a systems level. She is the convener of Washington Legislative and Policy Advocates, WLPA, a nonpartisan, all-volunteer educational venture. She also convenes the Mental Health Policy Roundtable. In December 2021, so just this last December, Laura was appointed to the Global Mental Health Peer Network as a country executive committee member representing the United States. Over her many decades of work, she has received several awards. For those of you who may not understand what it is to live with a mental health issue and also be an active advocate, it's a balance that many of us with lived experience strive to have. It can be a struggle at times. I am impressed and humbled by Laura. I'm glad to introduce her and look forward to hearing more of her story. Laura?
Thank you. Thank you very much. I'd like, if it's possible, to put the photograph on the page. Thank you. That is a photo of it's my mugshot, just to introduce it, when I was arrested in Salem, Oregon. The story I'm about to tell, though, is after that occurrence, but clearly I just wanted you to have a look at my state at that point in time, probably 6-7 months prior to the beginning of this story. So here I go. I'd been homeless in and out of shelters for some time, from 2012 to 2015. The following crisis story, told today, publicly for the first time, was when I had been living on the streets of downtown Salem, Oregon. I guess if I chose any city to sleep on the streets, Salem was a good choice. There were services immediately available downtown in this capital city. There were water fountains and restrooms in government buildings, a men's shelter to stand in line for lunch, a bread shop that put free samples out every day. And in those days, Starbucks gave free samples of coffee. No matter what, I was without a restful or comfortable night's sleep. The 15th time I approached Salem Health Hospital, I was involuntarily committed as gravely disabled. I had an advanced directive, but it was not followed. I was committed inside the county's psychiatric emergency center on the hospital campus, a set of trailers located in a corner of this large parking lot, almost the size of a football field. It was a huge parking lot. In a scene rife with irony and maybe so-called comedy, I was picked up off the floor where I'd been sleeping by the police, who had been called, handcuffed, and put into a police car, and driven to the opposite side of the parking lot, brought into the emergency room. I don't recall the police sticking around after that. What I do remember was a struggle, and I was pushed into an observation room onto a bare blue plastic covered bed face down and forcibly medicated. These are times when you don't exactly recall going from one part of the hospital to another. I ended up in the psychiatric unit for about 30 days. I guess it could be considered as today's crisis stabilization unit. The psychiatric unit, by the way, was in a freestanding building in yet another corner of the hospital parking lot. I say this because they offered, I guess it could be construed as today's crisis stabilization unit. I say
Laura, I'm so sorry. It looks like your computer just muted you.
I'm so sorry.
No, I don't think that was your fault. Thank you. So sorry about that.
I actually bumped into
Oh.
it. Yeah, I think I did.
Sorry to throw you off your rhythm there.
It was my left hand. I
Please
swear
continue.
it was.
No, I thank you so much.
Okay. I guess it could be construed as today's crisis stabilization unit. I say this because what they offered are part of the services offered in these programs now. It was a flexible setting with little structure and almost convalescent. I finally slept and the staff let me sleep. My commitment hearing was held via closed circuit TV, and I do not recall having a role in that process. It's a blur, maybe from the powerful medication they had given me when I was admitted days before. I could barely see. My eyeglasses were held together by tape and pins, and I had struggled to see for some time. My glasses had been so important to me, but I was able to rest and get more nourishment as the days went by. I would not call the unit a Pier 1 respite, however. They were very limited activities during the day, more or less to maintain a quiet milieu in the psychiatric unit. Each day began to look the same as the one prior. Even still, I found myself to feel grateful, to sleep, to be somewhere dry and safe, and to have food. After a month, I was asked where I wanted to go, and I said Eugene, where there was a familiar and safe women's shelter, as well as a community mental health center nearby. I had trouble seeing while I was in the hospital, and a nice licensed practical nurse, LPN, brought me an old pair of her eyeglasses and some clothes to bring with me to Eugene. I couldn't see well through her prescription, but it was better than nothing. The hospital provided me with a one-way ticket. Much later, I learned there were to be peer specialists in the emergency room, stationed there to help peers with behavioral health issues. In all my visits, 15 of them, day and night, I didn't meet one. That could have made a huge difference. I think a peer specialist visiting the hospital ward would be helpful as well to assist with discharge planning and basic contact. While the hospital was a safe haven, a peer respite might have been made better use of my 30-day commitment hearing as well. My time today may not allow for further illumination of this, but I would encourage more stories where peer workers are to be in the picture so you can get a sense of their value in this new systems design we call 988. If I were to do a root cause analysis of this experience and map it out, which I wish I had time to do with the 988 kind of overlay of what 988 could be, I would take a look at the mobile outreach services that we're hoping to employ, the kind of quote cahoots type role that we're looking at. I'd look at drop-in programs so that instead of wandering the streets incessantly for years, there could have been a drop-in program with water fountains and food. I would definitely be looking more closely at peer respite. It's an alternative to a hospital. The hospital allowed me more days than the typical respite. Respite is, like Senator Dinker is nodding, absolutely about 7 days, and thank you for that. But clearly the hospital ward, or this quote, what I would think would be kind of a stabilization unit, allowed for more time. And finally, I would look at real de-escalation, not only on the streets with the mobile crisis services, but what happens when you go into an ER? I got very excitable in the ER when they put me in the room with the forced medication. And that was because I was scared out of my mind. I thought I was gonna die. I thought I was gonna die. We cannot have places where people cross the threshold and think that they might die. I think I got really scared when I was handcuffed before I got to the seclusion room. So I think we really need to look at the de-escalation pieces very, very closely and the training involved in that. I just want to thank Pasha for talking with me, because what helped is that, yes, my story is long and there have been other kind of crisis events in my story, but she helped me focus to a narrow period where I could grasp more detail and share that with you with as much courage as I can today. So thank you very much for your time, for listening. Thank you.
Thank you very much, Laura. I'm Michael, CRIS committee member, lived experience committee member.
Hi, Michael.
Laura, thank you very much for sharing a piece of yourself. The vulnerability, the realness of it all speaks to, I think, to us as a group that the effect of peers and in their support in the moment of crisis, and in that support in those triage services that you mentioned that helped you stabilize, can't be taken for granted, nor can they be window dressing in this grand scheme of 988. It is probably for the hands-on the most integral part of what can make this thing go. We can always have clinicians, we can always have facilities, but if we don't have a lived experience person to walk through that with us, motivate, advocate, and create that space, then we're doing this all for naught. And because of you and your story, we get to reset, rebalance, and begin to really take a look at the nuts and bolts of what we need to do. And so we thank you. And with gratitude, we look forward to hearing more from you. Thank you for your input and thank you for your service.
Thank you very much.
Mm-hmm.
Absolutely. I'll see you on the road.
Laura, I just want to echo Michael and Bipasha. Thank you for sharing your story today and for all of the work you've been doing to make this happen, these changes we're working toward. It is so appreciated and we are so grateful. And I know it is not easy to tell this story, especially on a screen like this. So thank you.
Yeah, it's different.
It is, isn't it? Yeah. And that actually is a beautiful segue into the culmination of a lot of work from a lot of contributors to develop a vision for this behavioral health system redesign, crisis system redesign. So at last week's CRIS committee meeting, the work group, the ad hoc work group that formed to draft a vision, presented it to the CRIS committee and gathered feedback from CRIS committee members, as well as many of you who are here today who have participated with me in the main room. They reconvened and made a lot of great revisions. And I am excited to hear from one of those ad hoc work group members today, Kashi Arora, who's going to present the revisions and have our steering committee see the changes that have been made since last Tuesday's CRIS committee meeting. So without further ado, I'm going to turn it over to Kashi.
And I'm happy to take it on, but I think Suzanne actually starts for us. So maybe we'll start with Suzanne.
Yeah, okay. Sorry, Suzanne. I didn't mean to skip over you. Go for it.
No worries. First off, I just want to say how, Laura, thank you for sharing your story. I'm very moved. And you ended with, I was as courageous as I could be, or, oh my God, you are such a courageous woman. And thank you for all that you do. So I'm going to try to get my mind back to what I was supposed to be talking about here, just real quickly. If you could move to the next slide. Steering committee, the early part of this year, it said we need to have a vision statement, and you sent off a charge to form a group, an ad hoc work group, to put together a vision. And the group did meet on several occasions. You're very familiar with this slide that we've shown you a couple of times. I just want to recap that the group met on several occasions, developed a draft vision statement and guiding principles. And as you know, that was circulated significantly in the community. It's sub work groups, which is displayed on the screen also. And the group got back together last week and continued to take the feedback one by one, take the themes, and then say, what do we need to do to amend the vision statement? Just quickly before we do turn it over to Kashi, if you go to the next slide, Nicola, thank you. This next slide,
it shows up on my calendar, but I have every other Friday off.
Can I remind
Friday.
everyone to please put your mics on mute? Thanks so much. Sorry, Suzanne, go ahead.
No problem. So just wanted to take a moment to acknowledge all of the ad hoc work group members that participated. We had fantastic participation in all of the committees, the meetings that we had. The last one, several people couldn't attend, but very, very active group, very engaged, very, very respectful of each other. What I really saw was people listening to each other. And back to, Laura and Michael's comment about having peer involvement, and we did that. We really listened to what lots of people had to say, particularly the peer voice. So with that, I will turn it over to Kashi, who's going to go through some themes of the feedback that we heard, and then the revisions that were made to the vision. So Kashi.
Thank you. Thank you, Suzanne. Thank you, Nicola, for the opportunity to present. And thank you, Laura, for sharing your story and for lending your voice to this process as we developed a vision. The summary on the slide here is broken down into the themes of comments and feedback that we received about the vision statement itself, and then the following slide will be about guiding principles. So we'll stay here for a second, but as Suzanne mentioned, the ad hoc work group on drafting this vision and principles had the ability to seek input, thanks to the facilitating group as well, from the CRIS committee, from multiple subcommittees, including the Lived Experience Committee and the Tribal Subcommittee, and some other groups, myself, shamelessly, the Child and Youth Behavioral Health Work Group, that's the seat that I'm in. So wanted to hear what families thought about this work. And these were some of the major themes of comments specifically about the vision statement. I'm going to highlight just a couple of them. One of the first ones there is clarifying the focus on 988 versus the comprehensive crisis system. So our original draft actually only referenced 988, and it didn't reference the entire crisis response system that was around it, which I think people thought was not enough and not inclusive enough of the work that's going on. Recognizing that there are lots of populations who are impacted by crises, and that those are not necessarily limited to mental health or substance use disorder crises. We try to keep, especially thanks to the folks with lived experience who lend their voices to this process, the language to be accessible to those who are receiving the service. And we missed the mark a little bit on the first draft. And so we got some feedback that we needed to make the language more plain, accessible, direct, and about some specific terms like the term recovery and like the term struggling. So you'll see those change. One of the conversations that we had specifically in our most recent ad hoc vision work group meeting was about more action-oriented language, not wanting the vision to be something that's passive or offered to people, but something that we are actively doing and providing. And then a couple of comments about caregivers and family not seeing themselves in the vision, wanting to make sure this is reflective of access to timely, appropriate care. And then we spent some time discussing and going back and forth on how narrowly or broadly to scope our definition of struggling or need. Should we make that specifically about crisis? Should we make that specifically about behavioral health to differentiate 988 from 211? And I think you'll see where we landed in a couple of slides, but there was just some really thoughtful conversation about how we make sure that the doorway is wide so everyone who needs it can get through, and that you know what door you're walking through when you actually choose to do that. Let's go to the next slide, if you don't mind. This one is the summary of themes, the summary of themes of feedback that we got on the guiding principles. So again, those same groups provided their input and thoughts, and there were more specific feedback about guiding principles that had specific things we should add. So adding a reference to accessing high quality care regardless of geographic location, adding that care should be responsive to gender, sexual orientation, and people with disabilities. We noticed in all of the many iterations of this that we ended up dropping trauma-informed care, which was not intentional to do so, so needed to add that back in. We got some varying feedback about whether we should shorten the various guiding principles or add more detail to them, so we tried to strike a balance, recognizing that we need to talk about access to 988 and crisis response, respectful of the technology accessibility that exists in rural communities, and including a broader concept of community. The last two themes here I think are really important to highlight. So that second to last one was a feedback that the visual representation that was originally selected was a Venn diagram of the guiding principles for what the people in crisis should receive and the guiding principles for how the crisis system should be set up. And that visual, there was nothing in the intersection of the overlap in the Venn diagram. So there was feedback that that's an odd graphic to pick if there's nothing at the intersection. And I think that's incredibly valid, and it's references the ways that we need to think about visuals and how they impact our understanding of the language we use. And the last recommendation came from the tribal subgroup, which requested in addition to add a guiding principle that indicates that the crisis response system will be operated in a manner that honors tribal government to government processes. And if you go to the next slide, that will show you the draft that we have landed on, the revised draft, and I'm happy to take questions or talk about this further, but the vision is up there at the top. For anyone who can't see the screen, the vision reads 988, Washington's crisis response, building understanding, hope, and a path forward for those in need, where and when they need it. The Venn diagram with no overlap is gone. This is now two sets of guiding principles, one for people in crisis. The guiding principles are that people in crisis experience timely access to high quality, coordinated care without barriers, a welcoming response that's healing, trauma-informed, provides hope, and ensures people are safe. People in crisis experience person and family-centered care, and care that's responsive to age, culture, gender, sexual orientation, people with disabilities, geographic location, language, and other needs. On the right-hand side there, the crisis system is intentionally grounded in equity and anti-racism, centered in and informed by lived experience, coordinated and collaborative across system and community partners, empowered by technology that's accessible by all, sustainably and equitably financed, and operated in a manner that honors tribal government to government processes. I just want to share that this was a pretty significant inclusion of the feedback that we received from many different groups, and this ad hoc vision work group had a lot of different conversations about how best to represent the vision and the work that we want to see happening. And I'm excited to take questions and hear what other people think about it.
Thank you so much, Kashi. And I just want to remind everyone on the call today, the discussion is amongst steering committee members today. So I will be taking questions and feedback from steering committee members only at this time. Senator Dhingra.
Thank you. I first really do want to thank the ad hoc group for doing all the hard work on this. And I loved the process where people were able to provide their input. And I gotta say, I really like the end product. It seems a lot more crisp and to the point, and I am just really impressed. So thank you to everyone who contributed and came up with this. And I like that it's positive. I think the older version had some negative words, but this really makes me feel good about what we're aspiring to do and where we want to go. So I just have only positive things to say about this. So thank you very much.
Thanks so much, Senator Dhingra. I'm hearing that you're seeing this as being something really actionable based on the fact that it's very clear and direct. Bipasha.
Equitably financed. I'm sure the chair of our Ways and Means Committee will pay attention to that.
Bipasha.
So I have a question. So now that the Venn diagram's gone, does that mean that there's no visual? Is it just like this, Kashi?
That's a good question. I'm sort of looking through Zoom at Suzanne and others from HMA. This is the version as I know that it exists, so I don't believe there's another graphical representation being planned. I don't know if others want to contribute to that.
I mean, it's a minor input, but I think a picture speaks really loudly, something that's very evocative. So if the powers that be at HMA can, connect with someone who can create a nice graphic to then capture this content, it would be wonderful.
Great thoughts, Bipasha. Thank you. Senator Dhingra.
Yeah, and I just want to say, I think I'm more about the words and the language, and I think once that's approved, I think there are lots of different ways that people can get creative on how they're going to use these words and depict them. I would love to see some creative people do some TikTok versions of this. I'll just throw that challenge out there for anyone who knows how to do TikTok. But I think that we just have to get really creative on getting this message out. So I agree with what you said, Bipasha. I think how it's conveyed, I think we can get creative on that component.
Michael, I see your hand up. I know you served on the ad hoc vision committee. Are you offering some response to the steering committee question?
Yes, I kind of asked the same question about branding, and Michelle kind of cleared that up for me. It's a process that is a little more than just we can give it some branding and do it that way, but eventually down the line. But that being said, we also we don't want to just blanket that approach as well. We want it to be culture responsive. Just as the Seahawks have 4 or 5 different uniforms, we would also want 4 or 5 different stages of cultural responsiveness, as we have tribal members, urban, rural. All of these things have to be taken into consideration. So it's going to probably have many different faces. And so when we get to that point, I'm sure it'll be robust and it'll probably be very, very creative. As HMA and Michelle probably has some ideas, as they have already, with some other projects, already began to walk down that road. So
I think I'm hearing visual representation is on the table under consideration, and there will be some intentional work done. And Michael, thank you for making that great point and analogy about looking at this from a lot of different culturally attuned perspectives. Michelle.
Well, first, I just want to say I am not taking the senator up on her TikTok challenge. Not a skill set I have, but I love the creativity out there. I really also want to thank the committee and HMA staffing and others for leading us through this, and really feel super proud of and of the work you all did to get a lot of feedback from across the board from everybody who's is an investment and caring about this process. I think this work to kind of create a vision statement for us is just so important to creating that unity about where we're going, because there's so many people who are passionate, so much we want to get done collectively and seize this moment. And I think this final product, but also the process to get us there is strengthening our work together. So, and I feel really good about the final product as well. I will add on a little bit too. I think there's potential for a vision, like a better, like, do we want to graphically represent this this product? And yeah, we can keep talking more with HMA and others. And then what Michael was also talking about is we are working with communication staff at the department and healthcare authority to really think about the marketing and promotion and communications plans around 988 and longer term, but starting with kind of around this initial launch of the system in July. That is information that we want to also bring broadly to, once we're finished kind of with our internal drafting, but bring that information out to all of you, to the CRIS, to our partners, the different committees, to continue to get feedback. So that is coming as well. And then using the federal government, Vibrant and SAMHSA and others are working kind of with some national pieces that we can pick up and use and see what we like from that as well. So lots more to come in this area as we move towards July and then, after the official launch.
Thanks so much, Michelle. And so just to clarify, it sounds like there's some opportunities to use this as a launching pad for really getting more of the word out and letting people know about this process and what it means. But in the meantime, we can still move forward as a steering committee with affirming the vision and using it as our anchor as we continue the work. Bipasha.
Oh, I was just going to respond to Manka, who's the queen of detail. And so I completely agree with her. I mean, that woman can literally go down into the details of every line. And thank you, Michael and Michelle, for clarifying that, the visual also has to represent so many, but Maka is the one that has kids, and we know that, people have very short attention spans. So we do need something that's like, wait, what was that? And then they go back and read. So I think we all agree, and thank you for the ad hoc group, for all this amazing work. Thank you.
Any other feedback from steering committee members? Mark.
I thought it was very good. We saw it at the CRIS meeting last week, and it's just fabulous now. I mean, it's excellent work in a very short time. So thank you all.
Thanks, Mark. All right. So just a reminder of next steps. It sounds like we don't have any further requests or proposed changes as a steering committee member. I'm hearing just really positive feedback and agreement that it would be very valuable to move forward with visual representation. So that is certainly, I think, a key action item. In the meantime, as I mentioned earlier, we have 2 voting members who are not able to be with us today at the steering committee. So we are going to have a voting process that happens via email. What we'll do is we'll send this revised version, and I think probably some of the slides that Kashi presented will be helpful to remind everyone of the context, and then ask our steering committee members to vote to affirm this vision, and then we'll post those results to the website so that all of our community members can see the outcome of that, and then this can become our anchor for moving forward. Also, as I said at the beginning of the call today, it brought to mind that we do need to formalize a process for how we do voting when someone is not able to attend our steering committee meeting. So that will be another action item that we will take up. A big thank you to Kashi and Suzanne for the presentation today. That was very effective and helpful. And a huge, huge thank you to our ad hoc vision committee who did a lot of tremendous work in a very short time. So with that, I think we will move on to our next item on the agenda, which is the Section 109 Tech Op Plan update. And I believe Kelly McPherson is briefing us today. So Kelly, I don't think everyone here knows you, so if you could start by introducing yourself, and then we'll go through your presentation.
I will. Thank you. Yes, thank you, everybody. And thank you for allowing us to give an update today on the technical and operational planning work that we, Healthcare Authority, have been doing in coordination with the Department of Health. I'm Kelly McPherson. I'm the State Health Information Technology Coordinator for Healthcare Authority. And just a quick note as we go through these slides, we're going to, and before we get started here, because this work, the work that we are doing began early last fall, there's a lot to unpack, but we are very aware of how important this work is, and that those involved in this committee and others, how much they care about this work and the responsibility you carry in reporting out on it. So we felt like it was our responsibility to make sure that you're fully informed. So we're going to be going through the slides at a pretty clip pace. There's a lot, like I said, a lot to unpack, and hopefully we'll have some time at the end for questions. And then if we could just, I'm not sure, Nicola, are you doing the slides?
Yes, I'm ready to hear when you are, Kelly.
Perfect. We're going to skip slide 2 and we're going to go straight to slide 3. So just a quick level setting. This slide here is pretty much word for word from the bill, except for a few abbreviations of what the CRIS Steering Committee has to create a report on. So this report is informed by our work, subcommittee activities, HMA assessments, etc. So, we're going to look down here. Please note the responsibility of reporting on key components needed to coordinate crisis services, including bed tracking. So, and you guys will all get a copy of this slide, but this is just, again, just a level set on what is required of the bill. So we'll go down to slide 4. So our charge, Department of Health and Healthcare Authority, is to develop the plan. The draft plan we developed and submitted back in January, and the final one will be completed later this year. what we're doing now, this is the initial planning of this entire project. The bill states that before any funds are expended for the solutions, other than for the initial planning phase, which what we're in, the plan is to be submitted to several entities for review and approval. Slide 5, please. So we created the draft technical and operational plan, and there is a link on this slide at the bottom that will take you to that plan. Using information gathered from several sources, including behavioral health bed tracking, third sector or the Bomber report. The draft plan identifies next steps to address gaps, which is what we're doing now. And those will be identified and addressed in the final plan. So please, if we're not addressing any concerns or gaps that you see, please refer to that draft plan and you'll see that they will be addressed. In addition, we are conducting interviews and discussions with internal HCA staff, Department of Health, the military department, NSPLs, the VOA, and Accountable Community of Health, ACHs. So the draft plan uses a system of systems approach. It describes the future crisis call center platform and behavioral health integrated client referral system. It identifies next steps to address gaps and information about needed systems. The draft plan, again, that was submitted in January, was shared for review and comment, including the CRIS Technology Subcommittee and Steering Committee. And again, there's the link at the bottom that we'll send out. Slide 6. The final technical and operational plan will be how to procure needed technology solutions to enable the implementation of House Bill 1477. Developing the final plan requires information gathering from several sources, including crisis call lines, providers, responders, states, technology vendors, and more. Hoon is going to go over here shortly a little bit in more detail on that information gathering. But during these information gathering sessions, we're looking at meeting the requirements and the spirit of the bill. It also required us to identify functional requirements needed for platforms and technology systems, gathering information from vendors, and attending the CRIS committee subcommittee meetings. And I'm going to pass it on to Hoon. And Hoon, do you want to introduce yourself before you start?
Sure. So I'm Hoon. I use she, her pronouns, and I'm an enterprise technical architect with HCA. And I'll be going into a little bit more detail on what Kelly had presented. Next slide. So this is kind of a table of all of the information that we've been gathering. And so in developing the plan, we have been and will continue to gather information and requirements on the various needed components of the system to support this very necessary effort. Crisis call lines, we have the NSPLs that actually receive the calls, the regional crisis lines also receive the calls and do dispatch, and then additional lines for coordination and response, such as 911 and 211. We have the potential responders, which include behavioral health responders, as well as responders that you would normally find with a traditional 911 call, such as police, fire, EMS. And as Kelly had mentioned, you have the states that we have talked to and will be talking to just to learn what they're doing. And then, of course, like the technology, because we need the technology to support the different components in that systems approach. So Vibrant is the only actual technology that we've called out, the Vibrant Unified Platform. The other listed, such as CRMs and EHRs, bed registries, those are the types of technologies that are needed to support the system. And then, of course, we need to also integrate with other technologies such as like community information exchanges, case management, and care coordination systems. The next slide, please. So the functional requirements for the final plan were obtained through detailed review of the bill, the House Bill 1477. And some of the topics that we've covered in the draft plan, as Kelly mentioned, it's addressing the gaps. And then the various interviews from the following sources, the Baldwin report, the NSPL interviews, crisis providers, and then other reports. So all of these engagements were to develop the functional requirements. Next slide, please. And so as we're going through all those, we've been pulling out the vendors, and generally the vendors were mentioned in the Baldwin report or other states and interviews with the NSPL. So these vendors, we've chosen them because they have functionality that actually supports the 1477 bill. And so we will continue interviewing and looking at demonstrations. So with that, I will pass it to Benny.
Thanks. Next slide, please.
Jenny, could you introduce yourself really quick, please?
Oh, sure. Hello, my name is Jenny Harvell, also work at the Healthcare Authority, partnering with Kelly and Hung, others at the Healthcare Authority and Department of Health in the creation of the 1477 Technical and Operational Plan. So in addition to engaging in all of the various information gathering activities that are helping to address gaps that were identified in the draft plan and to help identify the functional requirements needed for the crisis call center system and enhanced behavioral health integrated client referral system. We have also been engaging in some of the CRIS subcommittee meetings, obviously the technology subcommittee, the Tribal 988 subcommittee, just the parenthetical. We've also been engaging in some roundtable conversations with tribal partners and also participating in the CRIS cross system subcommittee meetings. Next slide, please. So we wanted to provide information for the steering committee's awareness about what the technology subcommittee has discussed to date, as well as foreshadow what we anticipate coming up. In January, for those who are able to participate in that meeting, you heard an overview of the draft technical and operational plan that was submitted and is referenced at the link Kelly highlighted earlier in the deck. In March, we summarized the outreach updates that had been conducted up to that point. We summarized the providers that we had spoken with, the BHASOs and their input, tribal subcommittee, conversations that we'd had with the military department, and also with staff and DBHR. We provided an update on some of the technology solutions that at that point we had had conversations with. You can see those listed on this slide. And then also talked about the cross-state interviews that we had and some of the technology solutions that we had learned that these states had been or either were deploying or anticipated deploying. We also provided an update on federal engagement activities. In April, we provided a brief update about additional provider and state engagement activities. We didn't want to repeat what had been already presented in March. We provided a very quick snapshot of the work plan and timeline, just as a refresher of what was identified in the draft plan, and then associate those activities with a timeline. And we started an overview of the functional requirements that we had identified through all the information activities. The committee members during that April meeting requested more information on state activities and vendor demonstrations. Next slide, please. In the month of May, so I believe it's this coming Monday, there will be another technology subcommittee meeting. And during this upcoming meeting, we anticipate highlighting for the technology subcommittee the information that was just shared with you about how we identified the vendors that we have been engaging in discussions and demonstrations with. Again, if those vendors were identified in 2 or more of our data gathering activities, we've been reaching out to them, trying to learn about their systems and their deployment, and including obviously if those tools seem to support 1477 requirements. We will also follow up from the April conversation on functional requirements. During that April conversation, there was a lot of discussion about GPS and in-state call routing. So we'll provide a little bit more detail in the month of May about those particular issues. And we will also highlight some additional functional requirements that the technical subcommittee was not able to address during the last meeting. We will provide an overview of the final plan, particularly noting the fact that we anticipate that this plan will be a plan to procure technical solutions. And then we will also highlight upcoming agenda items. Next slide, please. So this, for the steering committee's information, are what we anticipate the agenda topics to be for future technology subcommittee meetings beginning in June. We want in June to have a presentation on the procurement and contracting process. We think it's important that the technology subcommittee understand the procurement and contracting rules that state agencies are subject to when we approach a procurement process, a competitive process. We don't want to run afoul of any contracting rules. And also, we do not want to inadvertently disqualify any potentially qualified or interesting vendor from that competition process. Also during June, we will provide an update of the state conversations that we've had regarding the activities that they've been engaged in with respect to their 988 and behavioral health crisis systems. In July, we will provide an update of our behavioral health interviews related to their crisis system activities. Also an update on the BHASO regional crisis line information gathering that we've engaged in. And we will also start a conversation about phasing in and prioritizing certain functionalities. And then finally, in August, we will present the final plan and we'll describe it and also describe the review process so that the technology subcommittee can understand both its content and the path going forward at that point for the next couple of months. Next slide, please. So we also want to say to the steering committee that because of time constraints today, we want to share with you a briefing paper on 2 technology topics that we started a conversation about during the April meeting. Those topics are GPS versus geolocation and in-state call routing and backup. We will share with the steering committee members a briefing paper on those topics, as well as a few PowerPoint slides that summarize the briefing paper. And we are requesting the steering committee's review and feedback on that briefing paper and PowerPoint by June 2nd. And we assume that if we don't get any feedback regarding our proposal, our approach with respect to those issues in the briefing paper, we assume that the steering committee will be okay with us proceeding as we identify in that briefing paper. Next slide, please. So that's a very quick overview. As Kelly said, there's a lot of information to cover. And so hopefully there's a bit of time for discussion today. This slide just tees up some questions. Thank you very much for your time.
Thank you, team from HCA. So there is some time for questions. We actually, according to our agenda, have until 5 for questions from our steering committee members. So just a reminder for folks, this is a steering committee meeting, so I'll be taking questions from steering committee members. And I see Senator Dhingra.
I'm so surprised, my hand's up right away. But thank you for providing that update. You know, if Rep. Orwell was here, she would tell you that I was harping on the technology subcommittee from the very beginning of when this bill was drafted. And I really do want to make sure we're leveraging the great technology background that so many people in our communities have. My question was, you know, I know that DOH and HCA have been meeting with vendors. Has the technology subcommittee members actually gotten presentation from the vendors themselves so they can visually see what these platforms look like, really get an understanding of everything that's required in the bill, how these technology platforms are able to meet those needs?
Yeah, so I agree. I'm extremely visual and I like to see. I want to visually see it. And we're you know, watching the demos and talking with the states and getting a really good idea of that flow and what it looks like. We just have to be so careful. I think it's because of the procurement process, right? And then forming those biased opinions. And so we are in discussion right now, Senator Dhingra, because we realize that is what you guys want. You want to see the demos. So we are going to make that happen. And we also understand that, you know, committee members are being contacted by these vendors. And, you know, without our knowledge. And so we may have already demoed one of them and have all of the information to share with the committee members. However, we hear you, and we are starting to schedule those. We'll be having a conversation about that at the next technology subcommittee on how to make that happen. We're just at the time constraint, right? So how do we do these demos? Can be up to 2 hours long. So if we do a demo, we still would like to, we still have, you know, we need your help. We're looking for direction on things, and, you know, the intent of the bill, we want to make sure. So we're trying to balance that. How do we do the demo and still get what we need and give you what you need? Because we're short on time.
Yeah. No, and I completely get that, the short on time. Now, the subcommittee is not part of the procurement process. So they're not going to have input once the RFP goes out, correct?
I think one of the things that we've talked about and are wanted to explore with you is whether or not, and if so, how the technology committee could potentially be engaged in a future RFP process.
Ooh, I like that a lot. I didn't realize that would be an option.
Yeah, we can have external people participate in the selection and review process for RFPs, which has been helpful in the past.
Yeah, and you know, since we're just having the discussion part of this, you know, to me it's really important that we have such great technology brains in Washington. To me, like, you know, unfortunately our government infrastructure when it comes to technology is extremely outdated. And this is really an opportunity for us to look at, you know, how can we be as cutting edge as possible? Can we have, you know, and I'm going to throw out words just because I'm married to an engineer, right? I am not the expert here. You know, web-based access, you know, different access based on credentialing. And so you have this big database. I definitely want to make sure, and I've been harping on this for a few years too, is a place where we can also store mental health advance directive. We started off with Laura's story about how her wishes in the time of crisis were not followed. Wouldn't it be so nice that 988 you call and someone says, oh yes, I see your mental health advance directive and this is what you have said you would like to see happen. Like, that is a critical part to me when we talk about putting the person and the individual first, is having that database that enables everyone to do so. Because one of the biggest barriers to using mental health advanced directives has been, how do you do it? Like, are people supposed to carry it on a USB stick around their neck? Like, how do they create that access to the providers who need this information? So anyway, I digress because
No,
this is why
I can
passionate about this
appreciate
topic.
that. I can appreciate that. And I'm actually working with Dr. Chris Chen at HCA on Advanced Directives Repository right now and reaching out to other states because of what you just said. So that's something that he's really championing at HCA. And this is all tied together. Yeah. So,
and that's the whole point, is that having one system where you can do bed tracking, you can do next day appointments, you can look at mental health advanced directives, you can figure out what medication people are and where the pharmacy is, so you can actually address the crisis. So, and to me, a lot of people who are on that technology subcommittee don't necessarily come from government. And I am not sure all those individuals understand how archaic our systems are.
Yeah.
And so I think it's nice for them to be able to visually see what we're aspiring to get to. But I completely understand the issues around procurement and making sure they're not biased, or that some vendors are given preferential treatment over others. But there is an education and learning component for them to actually see what's out there and whether what's out there meets the needs as articulated in the bill.
and that's why we're creating the crosswalk, but which you have not seen yet. And I think that will be very helpful of all of these different technologies and which do and do not meet the bill, what the other states are using. So we'll have the technology crosswalk as well as the state crosswalk. And I think that's really going to be helpful. But I hear you. I think having those demos would be helpful. So I think that's a conversation we're going to have concerning the RFP. Will you be involved in the RFP process? So yeah.
And before Bipasha, we go to Bipasha, one last thing. I think a very important component to me also are systems that can be adapted or not changed, but adapted to make sure that what Washington needs, we can get. And I can say from my other job, when they were going all electronic, we were able to find an online platform that was able to make specific changes so that it can clearly fit the needs that we have to Washington.
Absolutely. Yeah.
One thing, just Senator Dinkra, to follow up on your comment, I really appreciated your comment about the mental health advanced directives.
Yes.
And how important those are for a person-centered responsive crisis system. And I think on a technology side, one of the trade-offs or considerations is the currency and completeness of data in a repository versus a mechanism to exchange information from the source. And so from a technology point of view, I think it's a very interesting and important topic that needs to be considered and digested and thought through, because there certainly a repository could potentially be a place where a lot of documents could be stored. It may not be complete, and it may not be real time. And so in a time of crisis, having current and complete data is very important. So I think it's an important technology consideration that you highlight.
I see some hands up. So I'd like to take our steering committee member Bipasha's question or comment. Bipasha?
I don't know much, but someone said about committee members, the tech committee, subcommittee members being contacted by vendors directly without, HCA doesn't know, DOA. Can you expand that? That just, I don't know, that felt like a little bit of what is going on to me, so. I don't know if Kelly mentioned that. Jenny, you did.
I think it might have been Kelly who mentioned that.
Yeah,
but
yeah, and I think, thank you. I think it's pretty common that, vendors hear what's happening in Washington State and they want to be a part of it. So this is not unusual for that to happen. There's duplicate work going on. So you guys or whoever are receiving, hey, come in. We want to show you what we have. When we've already done that work, we've already crosswalked. The only thing that hasn't been done, like Senator Dingra was saying, is, you guys have been able to actually see the demo and ask your own questions. We're simply just tying it to the requirements in the bill. And so I understand the need to I guess have separate demos, but I think I would like to do it in a more coordinated manner, to where we're also aware that, you guys are, for example, Arizona, we met and did the crosswalk and whatnot. And then I just think there's duplicate work going on, and it could just be a little bit more coordinated. Yeah.
Thank you, Kelly, for clarifying.
Yeah.
And Hung, I see your hand up. I imagine you might have been responding to that original discussion we were having.
So as the technologist and I wanted to also address Senator Dingra's comments. And one of the key design elements that we're looking at is a very modular design. And that's really, to address your specific point, so that, as technology evolves, we can, almost like Legos, we can take out a component and, put a better, cooler component in. And, we're looking at all of these components as, picking the best. And so that's partly why we're looking at a wide array of different technologies and looking at what other states are doing. And a lot of what, the principles, the enterprise architect principles that we're looking at also is, buying technology that is future growth. And I don't know if you guys have heard of the, Magic Quadrant, but, the Gartner Magic Quadrants are best in class. And so one of those considerations is comparing, the different components to that. And so, pushing the envelope. So absolutely, we hear you. And, those are some of the ways that we're trying to achieve that.
I'll just say thank you for this discussion. I feel so much better about where we're going with the technology platform. Now you just have to deliver.
Absolutely.
We still have a little more time for questions or comments from steering committee members. And as a reminder, these are, I'm taking questions just from steering committee members today. So Mark, Amber, Michelle, Bipasha, Senator Dingra, if you have other questions, Mark.
So you mentioned that there's some documents that you want the steering committee to review and comment on by June the 2nd, but if I follow it right, it wasn't clear exactly when we would get those materials by. So is there an estimated date by which we would expect to receive the materials?
Yes, I hope that I need to clean up a couple of the words in the Word document today. I will send it to HMA this afternoon, and HMA, I assume, will forward it to the steering committee either today or tomorrow.
Perfect. Great question, Mark. Other questions from our steering committee members? All right. Hung, Kelly, Jenny, thank you so much for your time and all of the detailed and helpful information. I imagine our steering committee will be eager to review the presentation that they'll be receiving later today or tomorrow. So we really appreciate you coming today and sharing this information. And community members, I know you may have come out of this meeting with questions yourself or comments on what you heard today. I'm going to post the email for the project into the website, into the chat box. So if you do have feedback, please do send it via email. As I have mentioned before, we do package and share that information with our CRIS and steering committee members. Okay, thanks so much for that really good discussion. I'm going to turn it over to Betsy. Now we're going to move into our updates, and we've got a couple of updates. Betsy's going to share an update on the subcommittee activities and the status of gathering input on equity recommendations from our CRIS meeting back in March. And then Senator Dhingra, I think, is just going to share an update, a brief update on next steps following the Arizona delegation trip to learning trip that happened a couple of weeks ago. So let's start with Betsy.
Thank you, Jamie. I have just a couple of brief updates. As Jamie mentioned, want to give you all a sense of the hard work that has been occurring and underway in our subcommittees, as well as the process for incorporating feedback around equity, which is one of our principal deliverables, some recommendations about equity. So Nicola, would you share the slides, please? So April was a busy month for us. We had a number of subcommittee meetings, and those subcommittees focused largely on draft vision and principles. As you saw in the discussion today, we incorporated and elicited lots of feedback from subcommittees. So the Rural and Agricultural Communities Subcommittee weighed in, Lived Experience Subcommittee weighed in, and our Tribal 988 roundtable / subcommittee weighed in on the draft vision. So really good discussions. And at Rural and Ag, we also began to have a discussion about opportunities, to center equity. At the Tribal 988 roundtable on April 20th, there was also a discussion of the 1477 technical and operational plan. So that was actually a roundtable discussion with tribal representatives about the tech ops plan that you heard a little bit about today, or quite a bit about today. On April 20th, the Confidential Information Compliance and Coordination Subcommittee talked about our National Suicide Prevention Line call center privacy standards, as well as federal privacy laws and crisis system considerations. That was a really robust discussion, and we went way into the discussions about HIPAA and privacy, and folks were very engaged. On April 22nd, the next day, we had a credentialing and training subcommittee where we took the time to really, and this was with participation of our call center reps, to understand current federal and SPL call center staffing and training standards, and to think about the future. And then our tech subcommittee looked at our tech and ops plan and reviewed some of the functional requirements. And then the TBD is around our cross-system collaboration subcommittee. We had a meeting on March 17th, and we have been waiting to schedule another cross-systems collaboration subcommittee to bring forward some of the results of our process system mapping exercises that we've been engaged in, looking at the interfaces between 988, 911, and our regional crisis line. So we're going to be scheduling that subcommittee very shortly and bringing some of the discussion into the room there that we've been having around our process system mapping and the results that we're seeing, understanding our current processes. Last week, we had a CRIS committee meeting, and here we are today, May 19th, with our steering committee meeting. So as I mentioned, a very packed agenda of meetings in April, and now here today. Next slide, please. And so I'd like to just briefly talk about how our equity recommendations are winding through our process. To remind you, we're responsible for making recommendations to promote equity in services for individuals of diverse circumstances of culture, race, ethnicity, gender, socioeconomic status, sexual orientation, and for individuals in tribal, urban, and rural communities. So we started in March with the CRIS committee, gathering some input on how best to embed equity into the high-level work plan. So to remind you, our high-level work plan is the frame we use to ensure that we're addressing the continuum of care and services all across our crisis system, from the point of entry until the point of exit, and immediately pre and post. So we were asking for some feedback, and we started to incorporate that feedback into the high-level work plan. In April, May, and then going into June, we will be working with all of our subcommittees to gather more input into the high-level work plan. We're going to be synthesizing that input into major categories of recommendations. And so far, we're seeing categories around implementation, policy, capacity building, and there's policy again. So I think there's another one, but we're synthesizing those recommendations into these high-level categories. In September, we'll be bringing the recommendations to promote equity to the CRIS and the steering committee for review, and we're hoping to have steering committee approval in September. That is my update. Thanks, Jamie.
Thank you, Betsy. Senator Dingra, would you like to share an update on next steps following the Arizona trip?
Yes, and I just want to say thank you for that update. I remember when we all first started and people were concerned that not a lot of work was being done. There certainly is a lot of work being done, so thank you for
and
putting
Senator
it all
Dingra,
together.
I'll say, can we stop share so that you can have more of the floor? And thank you for that. Yes, we've been very, very busy.
Yeah, and thank you to everyone who's been participating in this work. I know we talked about and debriefed about the Arizona trip at the last CRIS meeting, and I just wanted everyone to know that it's not like we went on a trip and it's done. We do have follow-up work that we would love to do. And so what Rep. Orwell and I have been talking about, and I'll just say this is still in the talk phase. We're going to plan this out and send out details. But the plan is to do something similar to what we did in Arizona in 3 different regions, right? We have the 3 different call center regions. And so what we're going to try to do is do that for Region 1 with Crisis Connection, do a tour of, where we have the call center, do a tour of the crisis stabilization units, any other respite programs that we may have, and then do a debrief, either lunch or dinner or some kind of combination. The plan is really to make sure that all our partners in that area are all involved. So we have the cities, the counties, anyone else who's providing services. So for it to be a really open process in making sure, again, similar to what we did in Arizona, that everyone at each level of service providers can actually be in the same room having a conversation for the vision where it currently is at and where it needs to go. And so we'll do the same with the Volunteers of America region and then in the Spokane area. So that is the plan on the follow-up. That's to happen because we do know that it is the local individuals who will be providing that care. And so just making sure we're all on the same page on what that looks like. So lots more details on that for anyone who is interested in offering up a place they want us to come and do a tour because they think it's so fantastic and fabulous and fits into this. Please feel free to reach out. We are happy to incorporate any and all of that, and really making sure we're reaching out to be as inclusive as possible. We're not going to take 100 people, but and then really making sure that each region actually is about the individuals in that region, but that contact information and the details will be shared so that then after that, people can make their own connections and learn from each other as they go forward. So that is what our plan is for our follow-up after the Arizona trip. And the RI folks have been very generous and have said that they are welcome to do another tour if there are more people interested in attending. I'll just say there's no funding for this, so unfortunately it is on each individual's either business or personal dime. But if there is interest in people going out and doing the tour, please do let us know, and we're happy to arrange for another tour. I think we have the logistics down, and happy to answer any questions from any of the steering committee members.
Any questions, steering committee? Pretty straightforward. Thank you, Senator Gingras. All right, well, that moves us to action items and next steps. We have a few coming out of the meeting today. Nicola, I'm going to read through my notes here, and please jump in if there's anything I missed. First and foremost, you'll be hearing from us in the next couple of days with a follow-up to our discussion on affirming the vision. It will include the copy of the latest version of the vision, the slides that Kashi presented, and a method for voting members of the steering committee to vote to affirm the vision. So expect that from us shortly. You'll also be receiving, I think it was this evening or tomorrow from HMA, a copy of that PowerPoint from HCA regarding the Section 109 Tech Ops presentation, looking for your feedback by June 2nd. Thank you, Mark. Thanks for the prompt, Mark. I appreciate it. By June 2nd. So that'll be also in an email from HMA. HMA and HCA and Department of Health will be in conversations about moving forward visualization to accompany the vision. So you'll probably be hearing more updates about that in the future. And finally, I'll be working on a process for formalizing our voting in the absence of a steering committee member, so we can add that to our charter at our meeting in July. That's it for the action items I took down. Nicola, did I miss anything?
That's it, Jamie. Thank you.
Excellent. So I did a scan. Nicola, would you mind putting up the list of folks who've signed up to make public comment today? I did a scan of our participants, and I see only one person, Karen Kelly, on the list today. I do understand from Elizabeth that another community member might have written and asked if they can also make a comment, and there will be time because we still have another 29 minutes in our meeting. So I will open up the floor for others to make comments. But what I'm going to do is, this is the list of people who signed up. I did a scan of our participants. I don't see anyone on the other than Karen Kelly on the call. That said, there are a couple of phone numbers on the call, so please do send me a chat if you are on the call and still would like to make a comment today, and I will make sure I work you in. Karen, I'm going to call on you. I will give you 2 minutes, and I will use the timer just so that we can preserve time for other folks to make comments today, but please let me know if you need more time. I'm going to put it on the screen here, and then you can go ahead and start.
Hi, thank you. No, 2 minutes should be more than enough. A lot of information today, and I'll be honest, a lot of it went right on over the top of my head, and that's okay. I'm a learning work in progress. I do just want to reiterate the folks on the committee that talked about the need for those visual prompts, those visual things. I also am a visual learner, and so I understood the challenge and concerns around the infographic that they had included. However, I do think that that's going to need to be a priority so that parents like myself and people that are possibly going to be utilizing the system can really understand the how, the when, and the why, so we can assure that we're using it to its best. So that's just what I wanted to reiterate, and I just want to thank everybody for all the work that's being done. It's such an important thing for us to have. The current crisis supports are really not functioning in a supportive way for families. So I'm looking forward to seeing this change, and thank you very much.
Thank you so much, Karen. And it looks like we still have plenty of time if any of our other community members would like to make a comment today. I'll ask you just to use the raise your hand function to let me know. And the reminder of where to find that in the toolbar at the bottom of your screen. If you click on the reactions button, it should show you the raise your hand function. If you have trouble finding that, you can also send a chat directly to me, Jamie Strauss-Clark. So let me see if I'm seeing any hands up. We'll just give it let's just give it about 30 seconds here and see if folks, I know there was a lot to process today. So if there's, okay, wonderful. Julia, I'm going to set the timer here, but please let me know if you need more than 2 minutes and we can, or if the timer makes you uncomfortable, I can also take it off the screen. Why don't you go ahead and start?
So one, I don't mean to be really rude, but like you guys aren't talking about like pain, chronic pain patients and how they can get in touch with their doctors while they're in a mental health facility. And that's really bugging me because some people do have legitimate mental health issues that are in chronic pain. And I just feel like that's not being addressed. That's not being like, oh, I need to talk to my doctor and I need a prescription for pain medication. Like I literally could not bring my vaginal suppository, and I'm just going to use that word because that's what it is, because they wouldn't allow it in inpatient. And I'm like, this is what really helped my ovarian cyst and my endometriosis. What are you guys talking about that my doctor can't have a prescription for this? Like I was so angry. And then the doctor was like, I don't deal with like down there. And I'm like, what do you mean down there? Like I would just like a way to contact my endometriosis specialist in situations like that, because I know this isn't going to be the last time I'm an inpatient. Like I would like a virtual sit down and be able to talk to her. That's all, to get approval to just have my prescription. This is so ridiculous. They both tie into one another. Why isn't this happening? Like, and I'm like, you know, I'm going to school for software development, and like I know all this shit. I know how, like, I'm not gonna hold back on the cussing. Like this is just so ridiculous to me. We have computers, we have ways to get in contact with people. Why aren't we using those tools?
Thank you, Julia. Anyone else interested in making a comment today? Please use the raise your hand button and I'll call on you. Bipasha, this is for folks who are not on the steering committee. Did you have a steering committee comment to make, or?
I just wanted to respond to Julia.
Oh, so we don't respond to the public comments. Yeah, thank you so much. And I apologize. I should have reminded everyone of how the public comments work. All right, Max, are you ready to go? I'll go ahead and start the timer.
Okay, yeah, and I'm dialed in from my phone. Are you able to hear me?
Yes, you sound great.
Great, okay. I hope this is okay. This is more of a couple of questions because I can't really articulate myself well in front of a live audience. So one question would be, is there a good way to give public input in like interactive and or email format? And what would that be? And then the other question is, as a community health nurse that's been working with people experiencing mental health challenges and a former crisis line volunteer and also a person with lived experience with mental health challenges, I wonder to what extent community health nurses have a voice and a role in this process. I kind of scanned through the people who are in the committees, and I didn't really see any nurse voices represented. And I thought that was interesting because we're really front lines on some of this stuff. So I think we might have a lot of input that might be useful for this system redesign.
Thank you, Max. And I did post that email in the chat one more time so that you can see where to send that feedback. If you don't mind sending those other questions as well, I took them down. And any other community members today who either made a comment or have feedback but don't necessarily feel comfortable or want to speak on the screen, please do use that email and send your comments. As I mentioned, we do compile them and share them with our CRIS committee. Let's give it another 30 seconds and see if there's any other community members who want to make a comment today. Okay. Well, then I think we are at the end of our agenda today. Again, I'm going to stop the share so you don't have to look at the ugly timer. Again, I just want to extend a hearty thank you to all of our community members who participate, who come to the CRIS committee meetings and the steering committee meetings, and who participate on the subcommittee. Your engagement and input is so important to this process. A big thank you to our steering committee member and all of our presenters today, and a thank you to our community members who spoke today and shared your feedback. It is much appreciated. We will see you all again. I know many of you will be seeing each other at subcommittee meetings in the meantime, and then we'll see you all again in July. Everyone be well and have a good evening. Take care.
Thank you.